A recent article caught my eye. Earlier this year in March, there were a few releases in terms of a study that was going to be presented at the National Endocrine Society Conference. Dr. Young-Ki Lee of the National Cancer Center in South Korea studied over 2,000 workers, and he looked at the number of hours worked and also the incidence of hypothyroidism. And what he found was astonishing. So I'll admit these people worked a lot, but for the folks that worked between 50 and 80 hours a week, the prevalence was 2 times higher of hypothyroidism than those that worked between 30 and around 40 hours a week. Another finding was that for every 10 hours of additional work in a week, that could increase the risk of hypothyroidism by 46%. So every 10 hours, there was an increased risk. As a psychiatrist, why is that important to me? I am a big believer in the power of the thyroid. So the thyroid is a big deal for me. Why? Because I know that it can impact you in so many different ways. So the first way is physically. So symptoms of hypothyroidism are fatigue, low energy, hair loss. You can feel cold all the time. You can have constipation. There's increased risk for diabetes, obesity, heart disease, and even infertility. The thyroid is important in so many different ways in your body that if you're hypothyroid, it can have significant complications for you. So the second realm is psychiatrically. So psychiatrically, if you have hypothyroidism, you can have more emotional lability, more irritability. It can affect your mood. It can affect your anxiety levels. It can even cause psychosis in really extreme cases. In the third realm is the cognitive realm. So I know that hypothyroidism can cause people to feel um, mentally slowed. People describe feeling like they just don't have any memory anymore. They can't attend to tasks. Their ability to concentrate is decreased. Their mental dexterity is affected. They feel like they're forgetting things all the time. And this is so impacted when you have hypothyroidism that people can really notice a significant improvement when they start to get their levels corrected. So for me, knowing how much the thyroid can impact you and how many problems it can cause you, it's one of the very first things that I will look into when I meet a patient for the very first time. So again, when I saw this paper linking the number of hours worked and the increased risk for hypothyroidism, that was a big deal for me. So for many of you who are working a lot of hours, who are juggling a lot personally and professionally, for those who you finish your professional lives, but then need to start your second shift, taking care of your household responsibilities and your family care duties, it's all the more important for you to recognize the importance of the thyroid. So if you're having some of the symptoms I listed above, I'd really encourage you to make an appointment with your doctor or your psychiatrist and take a look at this and assess it and see if this may be something that you can address so you can start to feel better.